Hi everyone, welcome back to my channel. My name's Alyssa. We are so happy you're here. Just as a disclaimer, as always, I am a mom, not a doctor. This is not medical advice. If you have any questions about your health or someone you love's health, please consult your healthcare provider. And with that, let's jump right in. So this is the first video in a series of videos that we're going to be talking about the clinical specialists on the clinical guidelines. I've noticed on social media there's a lot of questions about what specialists to go to, where to find those specialists, are all of the specialists worth seeing? And also, what do we do at these appointments? And that's why I'm doing these videos, so that maybe by hearing our experience, it might help someone else. And with that, we're gonna jump right in, our first video topic being genetics. So we're gonna start off with the when and why we saw genetics. So we saw genetics when my daughter was 3 months old. Why we saw genetics was because it was on the clinical specialist clinical guidelines. Hi everyone, so sorry to interrupt the video, Future Liz here. Just wanted to hop on. I reviewed the clinical guidelines after this video was already filmed, and technically genetics is listed as needed. I know that our pediatrician and our care team highly recommended we did see genetics because of our diagnosis. I highly recommend you see genetics. You'll find out why in this video. Even though on the clinical guidelines, technically it is listed as needed, I still think it's extremely important. So just wanted to clarify, it is listed as needed. Thanks, back to the video. Basically, at the appointment, it started off like any other regular appointment. They did a physical exam on my daughter to check for different key features of Turner syndrome. These key features being things like webbed neck, widely spaced nipples, short stature. Of course, she was short stature. She was an adorable, tiny little 3-month-old. She was born at 6 pounds. Anyway, they also went over some developmental guidelines to make sure that she was meeting those very lofty developmental goals at 3 months. I swear these days, if your 3-month-old isn't doing your taxes, you should probably call your pediatrician. But in all seriousness, they went through some developmental milestones with me about Janie. And from there, we went over her karyotype. Now, this wasn't one of those appointments that was life-altering, big reveal, she has Turner syndrome or she doesn't. From my first video, you may remember we were diagnosed in utero. Amniocentesis was at 16 weeks. Our final amnio results were at 19 weeks. But this appointment was helpful because it was able to connect us with our health systems from a genetic standpoint so that we could find out that they actually didn't have our final amniocentesis results. We switched doctors between our amniocentesis and Janie's birth. So because of that, they were missing that key piece of information for her file. Why that's important in our case was because her karyotype includes a ring, which we ended up needing a microarray for. I mentioned that in our first video. It goes pretty in depth in the weeds, but on a high level, we needed to do a microarray because she has a ring in her karyotype to find out if she has a certain gene that would mean it was shut off. And she did. She had the XIST gene, which then shut off the ring, and theoretically, she should develop like every other classic Turner syndrome girl. So one thing I didn't like about our genetics appointment goes right along with us talking about her karyotype. Yes, Janie's karyotype is extremely rare, but that doesn't mean you can't provide your patient with a well-written medical document about their karyotype. They gave us a Wikipedia page. Now, side note, the Wikipedia page was informative. However, it is awful disheartening going to a prestigious place and getting a Wikipedia document about your daughter's diagnosis. I found this appointment beneficial because it really went in depth with what are the physical traits that she has? What are the physical traits she doesn't have? It was able to answer any of my questions that I might have had regarding her karyotype, regarding different things with the physical attributes of Turner syndrome. Some common themes I find on social media about the genetics appointment are as follows. There's a misconception online, and people tend to really trash talk genetic counselors for some reason. I do not feel this way. I think genetic counselors are amazing. I think they provide so many resources and so much information that I would not know without the help of a genetic counselor. But it seems like on the social media pages, genetic counselors get bad reps, which I absolutely see no need for and definitely do not promote. So, as kind of a recap, we went to this genetics appointment at 3 months. We had a good experience. We're glad we went. Will we see them again? Probably not. Genetics is one of those things that you see once, you get all of your questions answered, you get their card, and now you have a contact if you ever have any questions in the future. Plus, not everyone has all of their karyotype information and all of their genetics information before she's born like I did. So, meeting with genetics might be even more important to you if you are missing some of those building blocks for your daughter or son's karyotype. And honestly, that's about it. I hope this video helps someone that is either about to go into their first and possibly only genetics appointment. I hope this helps someone that maybe was on the fence about going to their genetics appointment. I found it beneficial. It's a one and done type of thing. And send your genetic counselors some love because they deserve it. And I know they probably need it. So send all the genetic counselors love, sending all of you love. Thank you so much for watching my video. And if you have any questions or comments, put them down in the chat or message me. Thank you so much. Bye, guys.